I'm Kelly Lendvoy, ACE's Communication and Public Affairs Vice President, and we are recording live from the CRA Arthritis in Quebec City, the 9th consecutive year ACE is hosting this event, and I'm joined today by one of my favorite colleagues and collaborators, Isabelle Troïtzky. And Isabelle and I work together for and with the Global RA Network. Isabelle, welcome.
Thank you, Kelly. Hi. Bonjour à tout le monde.
Maybe just to start, you can tell us a little bit about what the Global RA Network is.
Sure. So the Global RA Network is a group of patient organizations focused on patients suffering from rheumatoid arthritis. And they're a group of more than 30 organizations. They're in Europe, they're in the Americas, North, Latin and South Americas. And so we're working all together to support each other basically on common issues for patients and specifically the models of care for RA patients. So trying to find ways to better support these organizations and advocate for better equal models of care.
It's a serious disease here in Canada where almost 1 million people are living with rheumatoid arthritis, which is also the most common form of inflammatory arthritis. And it's a very complex and serious disease in all of these other countries as well, a very high incidence, a very costly burden to healthcare systems. And from a models of care point of view, we know that there's some important aspects in terms of the delivery and care, and that starts with early diagnosis and getting to see a rheumatologist as soon as possible. What kind of work has the Global RA Network done on those two areas and other issues around models of care?
So we started a few years back with a study across those regions to understand indeed what were the issues with early diagnosis, seeing a rheumatologist. So we compiled all these results, and that was great data to go advocate in each of these countries. More recently, we also launched last year, in June of last year, another tool to go to our decision makers, and this is the RA dashboard. So this is a dashboard that is looking at all the data around rheumatoid arthritis, but also general healthcare in different countries. So we do have 13 dashboards published yet, so from 13 different countries. And it is a great tool for those organizations in those countries to go to the decision makers and show what the gaps are. So so that could be around early diagnosis, seeing a rheumatologist, but also all the other gaps of virtual care, for example, and funding. And it's also a great way to compare with other countries.
Right. So people living in Canada here with rheumatoid arthritis could go to the Global RA Network website and be able to compare the delivery of care for them here in Canada with these 12 other dashboards in 12 other countries around the world.
Right. And it's easy to it's a very visually attractive dashboard, so easy to go through and see what's going well, what's not going so well. Also, something that has been highlighted by those dashboards is the lack of data.
Right. So those dashboards actually don't look the same as the other dashboards.
Exactly. So Canada, we're pretty good, but there are some countries where really our patient organizations members can't access data because they're not available or they don't exist. So it's also a good a good finding to bring forward
Absolutely.
to those decision makers.
What and then looking ahead to 2023, are there any other initiatives that the Global RA Network is considering for this year?
We want to look at the outcomes of those dashboards, or what our member organizations have done with it, and if they made any progress with the people they're talking to in their own country. So that's more status of and what should we do next, and are there any specific topics or sets of data in this dashboard that we need to work on. So that's that. We're trying to better our communications as well on social media, and making some more noise. And we're looking forward to actually meeting hopefully all of our members soon in person.
Right. Now, for members, there are some members-only tools and resources, but for the general public, for somebody living with rheumatoid arthritis, there's some really good information there. So where do they go to find the information?
So you just have to go to www.globalranetwork.org, and you'll go in the menu, and it's easy to navigate. But yes, indeed, there are some interesting tools for advocacy, so that patients can also contribute and advocate themselves. There is the patient pathway as well, so which shows all the different steps that a patient has to go through to on his disease journey, and for each step of the way some tools and resources and readings and literature that patients can access, and those dashboards again they're available there, and some other important resources.
Now, from our audience from Quebec, maybe you could also just repeat that to them in terms of where they can find information as well. Thank you.
Yeah. Donc, en effet, vous pouvez aller sur le site du Global RA Network, www.globalranetwork.org, et là vous y trouverez une foule d'informations en fait, donc le dashboard dont on vient de parler, mais aussi des outils pour tout ce qui est la défense des droits des patients, et aussi des ressources que le patient peut utiliser sur son parcours de santé. Voilà, donc une foule de ressources, mais c'est facile à naviguer. Donc je vous invite à y aller.
Great. Well, thank you, Isabelle, for joining us today.
Yes.
I'm looking forward to working with you in 2023. I should mention that ACE was one of the co-founders of the Global RA Network, and we continue to work very closely with all our members and serve as the secretariat. So we work very closely with you in the work that you're doing as program manager. So thanks again.
Thank you, Kelly.
Okay.